In the realm of medication and substance interactions, the combination of prednisone and alcohol is a subject that warrants careful consideration. As a responsible individual, I believe it is crucial to understand the potential risks and implications of mixing these two substances. This video aims to provide you with a comprehensive understanding of the effects of combining prednisone and alcohol, enabling you to make informed decisions about your health and well-being. Understanding prednisone. Prednisone is a synthetic corticosteroid medication widely prescribed for various medical conditions, including autoimmune disorders, allergic reactions, and inflammatory conditions. It is a potent anti-inflammatory and immunosuppressive drug that can effectively alleviate symptoms and manage underlying conditions. However, like many medications, prednisone comes with its own set of potential side effects and interactions. Prednisone's mechanism of action. To grasp the potential interactions between prednisone and alcohol, it is essential to understand how prednisone works within the body. Prednisone mimics the effects of naturally occurring hormones called corticosteroids, which are produced by the adrenal glands. These hormones play a crucial role in regulating various bodily functions, including immune system response, metabolism of fats, proteins, and carbohydrates, inflammatory processes, stress response. By mimicking these hormones, prednisone can effectively reduce inflammation, suppress the immune system, and alleviate symptoms associated with various medical conditions. Understanding alcohol. Alcohol, or ethanol, is a widely consumed substance that can have significant effects on the body, both short-term and long-term. When consumed, alcohol is rapidly absorbed into the bloodstream and distributed throughout the body, affecting various organs and systems. Alcohol's impact on the body. Alcohol can have a range of effects on the body, including central nervous system depression, leading to impaired coordination, judgment, and reaction time, dehydration and electrolyte imbalances, gastrointestinal irritation and increased risk of ulcers, liver damage and increased risk of liver diseases, impaired immune system function, increased risk of certain cancers. It is important to note that the effects of alcohol can vary depending on factors such as the amount consumed, individual tolerance levels, and overall health status. The potential risks of mixing prednisone and alcohol. While both prednisone and alcohol can have their own individual effects on the body, combining the two substances can lead to potentially harmful interactions and amplified side effects. Interactions between prednisone and alcohol. When prednisone and alcohol are consumed together, they can interact in several ways. Increased risk of gastrointestinal issues. Both prednisone and alcohol can independently cause gastrointestinal irritation and increase the risk of ulcers. When combined, the risk of developing these issues is heightened. Impaired immune system function. Prednisone suppresses the immune system, while alcohol can also impair immune function. The combined effect can leave the body more susceptible to infections and illnesses. Altered metabolism and excretion. Alcohol can interfere with the metabolism and excretion of prednisone, potentially leading to altered levels of the medication in the body and unpredictable effects. Increased risk of liver damage. Both prednisone and alcohol can potentially stress the liver, and their combined use may increase the risk of liver damage or exacerbate existing liver conditions. Side effects of mixing prednisone and alcohol. The combination of prednisone and alcohol can lead to a range of side effects, some of which may be more severe than those experienced when taking either substance alone. Potential side effects include increased risk of gastrointestinal bleeding and ulcers, exacerbation of existing medical conditions, impaired cognitive function and judgment, increased risk of infections, disrupted sleep patterns, mood changes and emotional instability, increased risk of osteoporosis and bone fractures, elevated blood pressure and cardiovascular risks. It is important to note that the severity of these side effects can vary depending on the dosage of prednisone, the amount of alcohol consumed, and individual factors such as age, overall health, and genetic predisposition. Precautions and recommendations for prednisone users. As a responsible individual taking prednisone, it is essential to exercise caution and follow certain precautions to minimize the risks associated with mixing this medication with alcohol. How to safely consume alcohol while on prednisone. If you choose to consume alcohol while taking prednisone, it is recommended to follow these guidelines. Consult with your healthcare provider. Before consuming alcohol, it is crucial to discuss your specific situation with your healthcare provider. They can provide personalized advice based on your medical history, dosage, and overall health status. Limit alcohol consumption. If your healthcare provider approves moderate alcohol consumption, it is essential to limit your intake to no more than 1 or 2 drinks per day. Excessive alcohol consumption can increase the risk of adverse interactions and side effects. Avoid binge drinking. binge drinking, or consuming large amounts of alcohol in a short period, should be strictly avoided while taking prednisone. This behavior can significantly increase the risk of severe side effects and potentially life-threatening complications. Stay hydrated. Alcohol can contribute to dehydration, which can exacerbate the side effects of prednisone. Ensure that you drink plenty of water and stay hydrated while consuming alcohol. Monitor for side effects. Be vigilant for any signs of adverse reactions or side effects, such as gastrointestinal discomfort, mood changes, or impaired cognitive function. If you experience any concerning symptoms, discontinue alcohol consumption and seek medical advice immediately. When to avoid alcohol completely while on prednisone. In certain situations, it may be advisable to avoid alcohol consumption altogether while taking prednisone. These include high-dose prednisone therapy. If you are undergoing high-dose prednisone treatment, it is generally recommended to abstain from alcohol consumption to minimize the risk of adverse interactions and side effects. Presence of specific medical conditions. Certain medical conditions, such as liver disease, gastrointestinal disorders, or a history of alcohol abuse, may warrant complete avoidance of alcohol while taking prednisone. During acute illness or injury. If you are taking prednisone to manage an acute illness or injury, it is advisable to refrain from alcohol consumption until your condition has stabilized and your healthcare provider deems it safe to do so. Pregnancy or breastfeeding. Alcohol consumption is generally discouraged during pregnancy and breastfeeding, and the risks may be compounded when taking prednisone. It is best to abstain from alcohol in these situations. Remember, the decision to consume alcohol while taking prednisone should be made in consultation with your healthcare provider, taking into account your specific medical situation, dosage, and overall health status. Conclusion. The importance of consulting your doctor. The effects of mixing prednisone and alcohol can be complex and potentially harmful. It is crucial to prioritize your health and well-being by consulting with your healthcare provider before making any decisions regarding alcohol consumption while taking prednisone. Your healthcare provider is best equipped to assess your individual circumstances, weigh the potential risks and benefits, and provide personalized guidance. By following their recommendations and exercising caution, you can minimize the risks associated with combining prednisone and alcohol and ensure the safe and effective management of your medical condition. If you are taking prednisone and have concerns about potential interactions with alcohol or any other substances, we encourage you to schedule an appointment with your healthcare provider. At our clinic, we prioritize your well-being and are committed to providing you with personalized guidance and support throughout your treatment journey. Contact us today to discuss your specific situation and receive expert advice tailored to your needs.